So this is skill 2.38, administering subcutaneous injections. Obviously, in order to administer subcutaneous injections, you're going to have to do this in the patient's room. Prior to that, in the medication room, you're going to, take out the medicine from the storage. You're going to draw up the correct amount of medication. You're going to make sure that you have the correct dosage, the correct, route and all that. You're going to make sure you also have the correct needle for a subcutaneous injection. Okay. All right. So for this demonstration, I have a 3 milliliter syringe with a 25 gauge by 5/8 inch needle on it. Okay, so is that a proper needle size for a subcutaneous? If you don't remember, look at the chart that I supplied for you on Blackboard. Okay, it is a correct. Okay, all right. So we're going to prepare the correct dosage inside of the medication room. Okay, so I'm just going to draw back. I've already showed you how to take medicine from a vial, so I'm not going to do that here at this. I'm just going to show you how to administer it. Okay, all right. I'm just preparing it so that we can do it. All right? All right. So this particular medicine that we have is going to be a 1 milliliter injection into our patient. Okay. So we've gone to our patient's room with our labeled medicine. Okay. We have our labeled medicine of the correct dosage, date, time, and all that, right? So we have our correct medication. We've gone to our room, we've done all the wipes of stuff, we have explained it, and we've done hand washing. And now we're going to put on gloves. Now, with all the other ones, I didn't have gloves on when I was preparing the medicine, did I? No. We're putting gloves on now because we may come in contact with blood, right? So we want to make sure that we have clean gloves on. Okay, so I've got clean gloves. And this is my patient's site for the subcutaneous injection. Again, if you need to know where those sites are, look on Blackboard because I posted something for you. You can also look in your Pearson textbooks and your skill books. I forget the pages, but they will show you exactly where subcutaneous injection sites are. Okay, so this is going to be our site. All right, so what you're going to do is you're going to clean the site with alcohol, okay, with a rubbing, whoops, that dried right out. Let me get another one. You're going to go in circles and clean the area. You're going to start from the inner and move out, okay? And so that's going to be our area to administer our medication. You're going to let it, the area air dry. Okay, because that kills the greatest amount of microbes, okay? So what you're going to do now is you're going to uncap your needle, okay? And you're going to hold the needle like you were throwing a dart, okay? So it's going to look like this, okay? It looks like you're throwing a dart or you're holding a pencil, okay? Most of you hold a pencil like this, right? Okay, that's how I like to hold it, like a pencil, all right? So you're going to hold it like that, all right? Then you're going to pinch up the fatty part of your patient, okay, of the injection site. You're going to insert the needle into your patient. Now, you're not going to go so slow that you're causing pain to the patient, okay? You're not going to go like this and jam it into him either, okay? It's not a dart. Okay, it really is not a dart. You're not playing darts. It's a slow and steady, quick insertion into the skin. Okay, when you have the needle in the skin, you're going to let go. You're not going to hold the skin for this. Okay, you're going to inject the medicine. Okay, slow and steady. Okay, and then you're going to hold it to a count of 10. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10. And withdraw. Okay? Now, you can either put a gauze on the site or you can just leave it, okay? Some of you may want to hold a gauze on that site, okay? So hold a gauze because liquid medicine may have seeped out of there. Blood may, a little bit of blood may come up. So we just want to hold a gauze there. There's no rubbing. I don't want you rubbing, okay? It's a general, it's a nice gentle pressure on that site, okay? Now we've got an exposed needle here, okay? We don't want that because that means that we could really subject ourselves or somebody else to getting a needle stick. So we want to make sure that we engage the safety device on our needle. Now, it depends on the type of needle that your facility is using as to how that device works, okay? This one is a simple snap-on. See, now I cannot re-expose that needle. No matter how hard I try, there's a safety mechanism in there that won't let me expose that needle, okay? So that's now a safe needle, but still it's gonna go in the sharps container, okay? So I've discarded it, and then I'm going to document in my the medication administration in my MAR, okay? And I'm going to continually assess my patients, on a regular basis, like we normally do, because we're nurses, right? Okay, so that is administering subcutaneous injections, skill 2.38.